New tonight, nurse practitioners in Hampton Roads say they need help to keep their practices open.
Group of 11 NPs are advocating for changes in insurance reimbursement rates and other restrictions. Investigative reporter Evan Watson shares how, without changes, these nurse practitioners say they could switch to cash-only practices, which would cut off access to care for people who can't afford it.
Because I was like, is it just me, or, is anybody else dealing with this? And it turns out we all are.
Katia Hall opened her own practice, Alpha Psychiatric Services, in 2018. She says nurse practitioners are at a financial disadvantage. For one, they receive lower reimbursement rates from health insurance companies.
We don't have capital laying in the bank, to kind of continue to keep covering this reimbursement gap.
Nurse practitioners often provide the same services that doctors or other physicians do, but insurance companies frequently reimburse nurse practitioners at 85% of the cost or less. This coalition says that's not fair.
So we should be reimbursed at 100% if we're providing the same services.
Health insurance leaders say the difference in rates is due to the difference of licensure and training. But Hall says many NPs have more medical experience.
A lot of us may have, 10, 20 years of bedside nursing experience before we go and we get a master's degree and, to become a nurse practitioner.
Hall says it can take 4 months to get re-credentialed when moving practices or months to get reimbursed for care.
If things continue the way that they do, then there's a good chance that a lot of us will decide not to take insurance at all. We'll go to a cash pay system. But who does that hurt? That hurts the patients, right?
She works in Chesapeake, where Health Institute data shows there's an 1,100 to 1 patient to mental health provider ratio. Without insurance, many people wouldn't be able to afford care. It's something nurse practitioners like Lakeisha Kennedy say they want to avoid.
I would hate to think about that, because it would be hard.
Because NPs are frequently filling the gaps of medical provider shortages. In Hampton Roads, the region's largest mental health care provider shut down in January because of financial problems.
If you take NPs out of the equation, then there would be a huge gap in care.
Hall, Kennedy, and a new informal coalition of nurse practitioners say they're asking lawmakers for help, but they're worried more NPs could close their practices because of financial problems.
The legislative way, we're going to try that first. But if that doesn't work in the next year or two, then, what options do we have?
In Chesapeake, Evan Watson reporting for 13 News Now.
The nurse practitioners in this group say they were flooded with requests for care after Christian psychotherapy services closed earlier this year. They say there's a mental health crisis in Hampton Roads. If there's an issue you think Evan should look into, email investigate@13newsnow.com.